In the nail, and then once I've got it all loosened, ready? Hi guys, it's Dr. Carter here at Lexington Podiatry, and I have this cute young lady with me today that had an injury about a couple of weeks ago, something about kicking her husband, I don't know. So we have a toenail now that's nice and bloody underneath, and it looks okay, it looks stable, but there's some redness down here, and that's the concerning part to me. If the blood underneath the skin is just in the nail, that's one thing. But if you start to get some swelling and redness back here, that becomes more of a problem, higher risk for infection, and we need to take the toenail off. So despite all of our efforts to not, we are there. So what I'm going to do is I'm going to squeeze. We've already numbed her up down here, so hopefully we did our job and her whole toe is numb. I'm going to slide this little tourniquet on as I attach my finger. And we're gonna paint it with some betadine and just clean it off. She's not allergic to the medications we're using, so we're good there. And now I'm gonna test her. I wanna make sure that the numbing medicine worked, because the last thing I want is to get started and her to feel this. Do you feel that pokiness there?
No.
Perfect. If you feel anything during the procedure, let me know. I trimmed the toenail trying to see if I could separate it and we could just take the toenail off, but once I started to trim, it was pretty mushy under here, so that was how we made the decision to take it off. So that was really cool. I started to loosen it and you could see the blood just being pushed out of there. All right, let's hope she's not squeamish.
I'm not looking.
Okay, good. So we're gonna loosen it. I'm going between the skin and the nail with a nail bed in the nail. And then once I've got it all loosened, we're gonna go underneath. So all that blood moving around tells me that there's still some liquid in there. It's not solidified yet. There we go. Oh, she's still not looking. Perfect. All right. So there's all this really dried blood in there that we're gonna, I don't really care about cleaning it up, so I don't want to create a more traumatized area for her if I don't have to. Yeah, right. She's being very tough. So I inspect the nail bed to make sure that there's been no damage as far as a cut or anything on the skin that could lead to a more aggressive wound or the need for more aggressive treatment. And I think we're good. Okay. Perfect. All right. Okay. Finished. We'll take that off. These do tend to bleed quite a bit, so I put pressure on it and immediately apply gauze with bacitracin on it, and then we're gonna wrap it up. The first day, you end up with a slightly bigger bandage, only because of the chance for it to bleed. After that, we can do a much smaller dressing. Look at that pretty little package. And as we know, anybody that watches my videos, we have to make sure that this heals perfectly, and that is how we do it. Perfect. All right, guys, thanks for watching. I hope you learned something about kicking your husband. Don't do it. Have a good day.